Hello, I'm Dr. John Luther. I am a retired family doctor. Today we're going to talk about glaucoma and macular degeneration. These are two types of diseases that can affect the eye as we get older. A lot of eye damage can be avoided if you see your optometrist every 2 years. Over age 65, see your optometrist every year. Let's look at the eye model. Here we see the white of the eye. Here's the cornea, a clear part, and in the middle you see the pupil. Pupil's nice and black, that's because light goes in it but doesn't reflect much backwards. Let's make the pupil disappear. Now you can't see the pupil. Let's look in the eye again. So there's the iris, this is where the pupil was. This is the lens, it's like a little magnifying glass. Here you see blood vessels that are covering the retina. The retina detects the light as it comes in, the light hits here. The light forms nerve impulses and goes to the optic nerve here, and then through the nerve to the brain. This little spot is the macula. Macula is a very important part. It is where you detect most of your vision. If you lose the macula, let's put my thumb over there, you can't drive and you can't read. Very important part. For macula, maybe remember match head, little match head like a macula. Let's talk about visual loss related to glaucoma and macular degeneration. Glaucoma tends to cause tunnel vision. So that happens at the front of the eye. It's not too bad here. If it gets like that, it might not be reversible and you might not be able to drive. But that's not going to happen to you because you're going to see your optometrist every 2 years. Let's talk about macular degeneration, little match head at the back of the eye. That tends to cause a loss of central vision. And if it gets worse, you're really not going to be seeing much, and you can't recognize faces. That becomes quite irritating, and you might fall over furniture. Let's talk about glaucoma first. Here's the front of the eye. The fluid in the front of the eye is formed behind the iris, comes through the pupil, and is reabsorbed here. If the pressure gets high, the optometrist will bounce airwaves off your cornea. If the cornea is hard, you may know that it's going to need special treatment to avoid peripheral loss of vision or tunnel vision. How do you treat this? You can use eye drops. Eye drops can be put on the white of the eye. There's dozens of these, and these are prescription only. If that doesn't work, you can have what's called laser therapy. Laser is just hitting the side of the iris there. Laser doesn't want to hit the inside, it's on the side of the iris. That'll make a hole and may drain. If you can't get it to drain, a small scalpel blade can be put in there, make a little hole in the iris, and that will help drain. So that's what glaucoma can do. Remember, glaucoma causes increased eye pressure. This isn't blood pressure, it's eye pressure. And remember, it's highly treatable, highly preventable, and you may never go blind, but you've got to see your doctor regularly. Let's talk about macular degeneration. Little spot at the back here. As you get older, blood vessels around the spot can leak. So you see the red blood vessels swelling up, and the blue indicates the leakage. This can be treated with laser. That's called wet macular degeneration. Little spots can form around the macula, and these can impinge on the macula. That's called dry macular degeneration. Both of these are called age-related because they get worse as you get older. Both types can be hit with laser. You don't want to get the laser right on the macula, you're going to go blind, but around the macula you can be hit for wet or dry macular degeneration. There's other things you can do. If you're getting the wet type of macular degeneration, your ophthalmologist can inject medication into the back of the eye, and that will stop the growth of blood vessels and decrease the leakage. It's not perfect, but it's one of the better treatments we now have. What do you do if you're losing a lot of vision and you can't get it treated? You can get a little telescope. This is much bigger than it is, just for a demonstration purpose. Two lenses together, and these go into the eye. One goes in front of the iris, and one in the back of the iris, and these spread the vision. So your vision spreads like this, and the vision that was hitting the macula is greatly spread, and you can see a lot more. Let's review that little telescope. There's one lens in front of the pupil, one lens behind the pupil. And if you're developing macular degeneration, your optometrist may suggest you take Vitalux vitamins. It's one of the few serious diseases that can actually be checked with vitamins and treated with vitamins. So let's go through the visual loss once again. With glaucoma, increased eye pressure at the front of the eye, loss of peripheral vision or tunnel vision, and with macular degeneration at the back of the eye, loss of central vision, which is actually a bit worse because it's hard to read, and it's hard to drive, and it's hard to recognize faces and colors. This is Dr. John Luther on glaucoma and macular degeneration. Remember, a lot of visual loss is preventable. See your doctor regularly, every 2 years, and see your optometrist every 1 year after age 65. Thank you.